That persistent lump in your throat and the mucus that won't go away? 73% of people over 50 ignore these symptoms for months, thinking it's just a cold or allergies. But I'm Dr. Valerie Stone, a general practitioner with 20 years of clinical experience, and I need to tell you something that might save your life. That sensation isn't what you think it is. And what's happening in your throat right now could be a warning sign your body is screaming at you to hear. This could be happening to you right at this very moment. Write in the comments what scares you most about throat symptoms and what city you're from. This helps me understand how our thinking community over 50 is living and what health challenges you're facing in different parts of the world. Your answers guide me in creating content that truly matters to you. Let me tell you about Margaret. Margaret was 57, a retired school teacher from Ohio. She came to my office after 8 months of feeling like something was stuck in her throat. She'd been to 3 doctors. They all said the same thing: postnasal drip, seasonal allergies, drink more water, take an antihistamine. Margaret did everything they told her. Nothing changed. She kept clearing her throat constantly. The mucus was always there, thick, stubborn. She couldn't swallow comfortably. She started avoiding social situations because she was embarrassed by the constant throat clearing. Her husband noticed she'd stopped singing in the church choir, something she'd done for 30 years. When Margaret finally sat in my office, she looked exhausted, not just tired, defeated. She said something I'll never forget. She said, "Dr. Stone, I feel like my own body is betraying me, and nobody believes me." I believed her. And what I found changed everything. Here's what most doctors won't take the time to explain to you. That lump in your throat, that medical term is globus sensation, and the chronic mucus production are not separate problems. They're connected. And in people over 50, they're almost never just a cold. Your throat is like a sensitive alarm system. When something's wrong deeper in your body, your throat rings the bell first. But we've been trained to silence that alarm with lozenges and cough syrup instead of asking why the alarm is going off in the first place. Let me break down the 5 real reasons you're experiencing these symptoms. And I promise you, by the end of this, you'll understand your body better than you ever have before. The first hidden cause is silent acid reflux. Notice I said silent. This isn't the heartburn your grandfather complained about. This is acid creeping up from your stomach into your throat while you sleep, while you sit, while you live your normal life. You don't feel burning. You feel mucus. You feel a lump. You feel like you need to clear your throat every few minutes. Think of your esophagus like a one-way street. After 50, the valve at the bottom, the one that keeps stomach acid where it belongs, starts to weaken. It's like a door that doesn't close all the way anymore. Acid leaks through. It touches the delicate tissue of your throat. Your throat responds by producing mucus to protect itself. More mucus, more irritation, more lump sensation. It's a vicious cycle. Robert was 62. He worked in construction his whole life. Strong man, tough man. He came to me because he thought he had throat cancer. He'd been coughing up mucus for 6 months. He felt a constant lump. He'd lost weight because eating made it worse. He was terrified. I ran tests. No cancer. But his throat tissue was inflamed and damaged from acid exposure. He had no idea. He never felt heartburn. Not once. A study published in the Journal of Gastroenterology found that up to 60% of people with chronic throat symptoms have silent reflux, and most of them have no classic heartburn symptoms. 60%. That's more than half of you watching this right now. What did I tell Robert to do? First, no eating 3 hours before bed. Gravity is your friend. When you lie down with food in your stomach, acid has a free pass to your throat. Second, elevate the head of his bed by 6 inches. Not just more pillows, the entire bed frame. This keeps acid down where it belongs all night long. Third, eliminate trigger foods for 30 days. Coffee, chocolate, alcohol, tomatoes, citrus, fried foods. I know it sounds hard, but Robert did it. Within 3 weeks, the lump was gone. The mucus decreased by 70%. He told me he felt like he had his life back. The second hidden cause, and this one will surprise you, is chronic stress and anxiety. You're probably thinking, Dr. Stone, are you telling me this is all in my head? No, I'm telling you it's in your nervous system, and your nervous system controls your throat muscles. When you're stressed, your body goes into fight or flight mode. Your throat muscles tighten. They stay tight for hours, for days, for months. This creates the sensation of a lump. Medical term, globus hystericus. But there's nothing hysterical about it. It's real. It's physical. And it's incredibly common after 50. Why after 50? Because this is the age when life throws everything at you at once. Retirement, health scares, losing parents, worrying about your own mortality, financial pressure, loneliness. Your body keeps the score, and your throat is often where that score shows up first. I had a patient named Linda, 54 years old. She was a caregiver for her mother who had dementia. Linda came to me convinced she had a tumor. She could barely swallow. The lump in her throat was so pronounced she could point to exactly where it was. I examined her. I scoped her throat. Nothing. Completely clear. I sat down with Linda and asked her about her life. She broke down crying. She hadn't slept more than 4 hours a night in 2 years. She felt guilty every moment she wasn't with her mother. She'd stopped seeing friends, stopped exercising, stopped living. Her body was holding all of that tension in her throat. Here's the science. A study from the American Journal of Medicine followed over 2,000 patients with globus sensation. 41% had significant anxiety or depression. When they addressed the mental health component, 78% saw their throat symptoms improve or disappear completely. 78%. This isn't alternative medicine. This is documented medical fact. What did Linda need? She needed permission to take care of herself. She needed to breathe, literally. I taught her a simple breathing exercise, 4 seconds in through the nose, hold for 4 seconds, 6 seconds out through the mouth, 3 times a day, 5 minutes each time. I also referred her to a therapist who specialized in caregiver burnout. Within 2 months, Linda's lump was gone. Not because it was imaginary, but because her nervous system finally felt safe enough to relax. If this story made you think, support this video with a like and subscribe so more people can learn how to truly protect their health. Now let's get back to the most important information. The third hidden cause is postnasal drip, but not the kind you think. Everyone talks about allergies, pollen, dust, pet dander. Yes, those matter. But after 50, there's another culprit nobody mentions: hormonal changes, especially in women. As estrogen levels drop during and after menopause, the mucous membranes in your nose and throat change. They become drier in some areas and overproduce mucus in others. It's like your body's thermostat is broken. You get thick mucus that drips down the back of your throat constantly. You feel it, you taste it, you can't get rid of it. But here's what makes it worse. Medications. If you're taking blood pressure medication, antidepressants, antihistamines, or sleeping pills, you're likely making your mucus thicker and harder to clear. These medications dry out your mucous membranes. Your body responds by producing even more mucus to compensate. It's like trying to put out a fire with gasoline. I treated a woman named Patricia, 61 years old, former nurse. She knew her body. She came to me frustrated because she'd tried every allergy medication on the market. Nothing worked. I looked at her medication list. She was on 3 different drugs that were drying her out. I worked with her cardiologist to adjust her blood pressure medication to one that didn't have that side effect. I had her stop the antihistamine she'd been taking daily for 5 years. Instead, I recommended a saline nasal rinse twice a day and a humidifier in her bedroom at night. Here's the key. The saline rinse has to be done correctly. Use distilled or boiled water that's cooled down. Never tap water. Mix in the saline packet. Lean over the sink. Tilt your head to one side. Pour the solution into the upper nostril. Let it drain out the lower nostril. This physically washes away the mucus and irritants. It's simple. It's cheap. And according to research published in the Archives of Otolaryngology, it reduces postnasal drip symptoms by 64% when done consistently for 4 weeks. Patricia did this religiously, morning and night. Within 3 weeks, her mucus production normalized. The lump sensation faded. She told me she hadn't felt this clear-headed in years. She didn't realize how much that constant mucus had been affecting her sleep, her mood, her energy. Now, the fourth cause is something that terrifies people, but we need to talk about it honestly. Thyroid problems. Your thyroid is a small butterfly-shaped gland in your neck. It controls your metabolism. After 50, especially in women, thyroid function often declines. When your thyroid swells or develops nodules, it can press against your esophagus and trachea. This creates a physical lump sensation. You're not imagining it. There's actually something there. But here's what's insidious. Thyroid problems develop slowly. So slowly you don't notice. You think you're just getting older. You're more tired. You're gaining weight. Your hair is thinning. Your throat feels tight. You assume it's age. It's not. It's your thyroid crying for help. I'll never forget James, 59 years old, accountant. He came in for a routine physical, mentioned in passing that he'd been feeling a lump in his throat for about a year. He figured it was stress from tax season. I felt his neck during the exam. His thyroid was enlarged. I ordered an ultrasound and blood work. He had hypothyroidism and a nodule that needed monitoring. His TSH level was over 8. Normal is under 4. His body had been struggling for years. According to the American Thyroid Association, more than 12% of Americans will develop a thyroid condition in their lifetime, and up to 60% of people with thyroid disease don't know they have it. Women are 5 to 8 times more likely than men to have thyroid problems, and the risk increases dramatically after age 50. We started James on thyroid hormone replacement. Within 6 weeks, the lump sensation decreased. His energy came back. He lost 15 pounds without changing his diet. He told me he felt like himself again for the first time in 5 years, all because we checked his thyroid. A simple blood test. That's all it took to identify the problem. If you have a persistent lump in your throat, demand a thyroid check. TSH, free T4, free T3, and thyroid antibodies. Don't let a doctor brush you off. This is your health, your life. You deserve answers. The fifth and final cause is the one nobody wants to hear, but I have to say it. Chronic inflammation from diet. What you eat every single day is either healing your throat or destroying it. After 50, your body doesn't tolerate inflammatory foods the way it used to. Dairy is a massive culprit. It thickens mucus, makes it stickier, harder to clear. Sugar feeds inflammation throughout your entire body, including your throat. Processed foods, refined carbohydrates, artificial additives, all of these trigger your immune system to produce more mucus as a protective response. Think of your throat like a river. When the water is clean and flowing, everything works. But when you dump sludge into that river every day, it gets clogged, thick, stagnant. That's what's happening inside you. I had a patient named Dorothy, 66 years old, retired librarian, sweet woman. She'd been dealing with chronic mucus and throat clearing for 3 years. She'd seen an ENT specialist, had a scope. Everything looked normal. She was told to just live with it. When she came to me, I asked her to keep a food diary for 2 weeks. She did. I saw the pattern immediately. Yogurt every morning, cheese with lunch, ice cream most nights, bread with every meal. I asked her to try something radical. Eliminate all dairy and gluten for 30 days. Just 30 days. She was skeptical, but she was also desperate. She did it. By day 10, she noticed a difference. By day 20, the mucus was 70% better. By day 30, the lump in her throat was completely gone. She couldn't believe it. She'd suffered for 3 years. The solution was on her plate the whole time. Research from the Journal of Clinical Immunology shows that dairy proteins can trigger mucus production in susceptible individuals, and this sensitivity increases with age as our digestive enzymes decrease. Gluten can cause inflammation in the throat and esophagus, even in people who don't have celiac disease. This is called non-celiac gluten sensitivity, and it affects an estimated 6% of the population. What should you eat instead? Clean protein. Fish, chicken, eggs if you tolerate them. Lots of vegetables, leafy greens, cruciferous vegetables like broccoli and cauliflower, healthy fats from avocados, olive oil, nuts, and seeds. Fruits, but not too much sugar. Plenty of water. Half your body weight in ounces every day. If you weigh 160 pounds, drink 80 ounces of water. Let me give you a simple self-test right now. You can do this mentally as I speak. First, think about your mucus. Is it worse after you eat certain foods? Do you notice more throat clearing after dairy or bread? Second, when do you feel the lump most? Is it worse in the morning when you wake up? That suggests acid reflux. Is it worse during stressful moments? That suggests nervous system involvement. Third, press gently on the front of your neck where your thyroid is. Does it feel swollen or tender? If yes, you need that checked. Fourth, how's your stress level on a scale of 1 to 10? If it's above a 7 most days, your throat is holding that tension. This simple self-assessment can point you toward which of the 5 causes is affecting you most. You might have more than one. Most people do. But now you know what to look for. Let me tell you what happened to Margaret, the retired teacher I mentioned at the beginning. Remember, she'd been suffering for 8 months. 3 doctors dismissed her. When I evaluated her, I found she had a combination of silent reflux and stress-related muscle tension. Her throat tissue showed signs of acid damage, but her muscles were also chronically tight from the anxiety of not knowing what was wrong with her. I put her on a comprehensive plan: dietary changes to reduce reflux, elevation of her bed, a daily breathing practice to calm her nervous system, and I referred her to a voice therapist who taught her how to relax her throat muscles. It took time. This wasn't a quick fix, but within 3 months, Margaret was singing in her church choir again. She sent me a video of her performance. I cried watching it, not because I'm sentimental, but because I know how much suffering she endured, and how simple the solution was once we actually listened to her body. Here's what I need you to remember. That lump in your throat is not normal. Chronic mucus is not something you just have to live with. Your body is trying to tell you something. The question is, are you listening? Let me give you a clear action plan you can start tomorrow. Step 1, keep a symptom diary for 1 week. Write down when you feel the lump or mucus most, what you ate, how you slept, your stress level. Patterns will emerge. Step 2, eliminate dairy and gluten for 30 days. I know it sounds extreme, but if diet is your issue, you'll know within 2 weeks. You can always add foods back later. Step 3, start the saline nasal rinse twice daily, morning and night. Use distilled water. Be consistent. Step 4, elevate the head of your bed by 6 inches. Put blocks under the bed frame legs. This helps with reflux even if you don't think you have it. Step 5, practice the breathing exercise I mentioned. 4 seconds in, hold for 6 seconds out, 3 times a day. This retrains your nervous system. And step 6, the most important one, get your thyroid checked. Ask your doctor for a complete thyroid panel. If they refuse, find a doctor who will listen. You deserve answers. I'm begging you, don't ignore these symptoms. Don't let another doctor tell you it's just a cold or allergies when it's been going on for months. Your health is not something that just happened to you. It's something you have the power to change with the right information and the right actions. You have grandchildren who need you, dreams you haven't fulfilled yet, years of vitality ahead of you, but only if you take care of the body you're living in right now. In the next video, I'm going to reveal the truth about dizziness after 50, why it happens, what it really means, and the 3 tests every person over 50 should demand from their doctor. This is information that could prevent a fall, a fracture, or worse. You won't want to miss it. Your throat has been trying to tell you something. Now you know how to listen. Now you know what to do. Take action today. Your future self will thank you.